The body of every woman in the reproductive age group goes through a process, and that process is called menstrual cycle. This is a cyclical process that occurs in the female body in preparation for pregnancy. The cycle, on the average, happens every 28 days and may range between 21 and 35 days. The onset of menstrual cycle is usually on the average between 12 and 13 years for the young female, and it may be as early as 8 years of age or as late as 17 years of age, and various factors may be responsible for these differences. For young girl, after the onset of puberty, about 2 years following the onset of puberty may be usually the onset of the menstrual cycle. So, as you may be aware, the onset of your own menstrual cycle, that is the age at which you started, which is called the menarche, is different from another. Another woman could have started at the age of 12 and yours could have started at the age of 15. So it varies. The age at which a female begins a menstrual cycle vary. That is called menarche. So the menstrual cycle is a process. It's actually a process that your body gets prepared to conceive pregnancy. And in this video, we'll be looking at the process in a simplified form. We'll be looking at the different stages, the phases involved in the menstrual cycle. Interestingly, it is not just a way of getting to prepare a woman's body for pregnancy. In fact, some women actually use this to plan how to avoid getting pregnant. So you need to watch this video to understand how your body works as a woman. The menstrual cycle also helps you to know when the cycle is becoming abnormal. Stay tuned. There are basically two phases of the menstrual cycle. The first phase, which is called the follicular phase, is the phase where the uterus builds up, gets thickened, and then prepares to shed blood and some other materials contained from the uterus. And the first day of the menstrual cycle is called So the uterus gets increased blood supply and begins to thicken with supply of nutrients to the uterus. And this is in preparation for bleeding. The first day of this bleeding is considered the first day of the menstrual cycle. The period in which this bleeding occurs is called the menses, usually known as the period of menses. And this may last between 3 to 8 days. And on the average, some may bleed for 5 days. But the first 2 days are usually the time when the bleeding is heavy and begins to go mild towards the end of the menses. In this follicular phase, as the uterus begins to thicken, the ovaries also begin to mature and egg, which is later released about the 14th day. So the uterus begins to get prepared for possible pregnancy by the increase in blood supply, by the thickening, and some hormonal changes that are taking place. So between the 8th and 14th day, that is following the shedding of the walls of the uterus, the content of the uterus, following the menses, the uterus begins to receive more blood supply and nutrients, that is in preparation for pregnancy. And about the 14th day, the mature egg is released. This is known as the ovulation. So the mature egg and the released egg from one of the ovaries begins to travel along the fallopian tube in preparation for possible fertilization. Okay, so and the journey continues from there. Watch out for part 2 for the conclusion on the explanation on the process.